You're just very tired and weak.
Runny nose, the teary eyes.
Aches all over,
Feeling heavy-headed.
just getting plugged up all through here.
Does that sound familiar? Most of us know what it feels like to get a cold or flu. Usually we fight it off and feel better in a few days. But not always.
It sounds like you do have an episode of bronchitis that we need to treat.
The common cold and sore throat, bronchitis,
Just say for a moment.
sinusitis, pneumonia. They're called respiratory infections. This program will help you understand what they are and when a doctor's help is needed, so you can breathe easy. Lauren Flanagan relies on her voice to make beautiful music. As an international opera star, she is always on guard against infections that could affect her art and her livelihood. Every day as she warms up, she listens for signs of phlegm, loose mucus from her lungs and throat. You might not notice it, but she does.
You hear that? I have to get rid. That's what I have to work really hard to get out of my singing.
So, in addition to working regularly with an accompanist, Lauren works with a physician who specializes in helping performers stay healthy.
Performers have a greater need to use their airway instruments than you and I. If my voice is a little husky, it doesn't matter. I can do my job. But a singer has to produce crystal clear notes and has to do them every time. So I can restore my airways to 95%, and I'm fully functional. But that's not good enough for the performer. Their airways have to be at 100%.
But we all need to take care of our respiratory health, not only with regular checkups, but with awareness. That starts with understanding just what the respiratory system is and how infections can affect it.
The respiratory system includes the nose, the throat, the conducting airways going down to the lungs and the ears. And when there's an infection, you can get swelling and redness and irritation in these different parts, and sometimes you can get overwhelming infection, which can impair function.
4 kinds of respiratory infections may affect adults: the common cold and sore throat, sinus infection, bronchitis, and pneumonia. The kind of treatment you need may depend on whether your infection is caused by a virus or bacteria. Wherever we go, whatever we do, we come into contact with tiny living organisms, germs. Some of them can make us sick, but how we're treated depends on whether the germ is a virus causing a viral infection or bacteria causing a bacterial infection.
There is a significant difference between viruses and bacteria.
Viral infections cannot be treated with antibiotics. Antibiotics only kill bacteria.
Bacteria are a type of organism which might respond to antibiotics if they're properly treated with the appropriate antibiotic. Viruses are much smaller particles and they are not affected by antibiotics. Hi, Betty. So it is very important that when we see patients that we try to differentiate so we know whether antibiotics will be of help in treating their infection.
But sometimes a viral infection can lead to a bacterial infection.
If everything's really inflamed and irritated from a viral infection, a bacteria has a greater chance of getting in and taking hold, and then it becomes the predominant infection.
How do you know this is happening? One factor is time.
The patient, when they're progressing from a viral infection and transitioning over to a bacterial infection, may find that after feeling better for a few days, now they're feeling worse. They may be coughing up more sputum. The sputum may be looking yellow or green after initially being clear, and they may have new fevers. We use all of that to be alerted that now there may be a bacterial infection that may need antibacterial therapy with an antibiotic.
Betty is like a lot of us. She gets a cold about once or twice a year.
Most of the time it starts with just a general feeling of being tired, and then the stuffiness in the head, and then just feeling washed out. And I may get a temperature for a day or two, a low-grade temperature.
You can get a cold or sore throat any time of year, but you're more at risk in the winter.
It probably has to do with the fact that that's the time of year when everybody comes indoors, they close windows, and they are basically closed up with one another in a group, and so you automatically spread viruses among one another.
Symptoms of the common cold can include a runny and stuffy nose, sneezing, scratchy throat, and a dry cough. Sore throat symptoms include pain in the throat, pain or difficulty swallowing or talking, and headache. With a common cold or sore throat, fever is usually absent or quite low, usually less than 100 degrees. For this illness, there's no cure.
The common cold, unfortunately, still is outwitting us. We can give things to treat the symptoms for a common cold. Again, this is a viral infection, but unfortunately, antibiotics are not effective for the common cold.
Sinuses are air pockets in the skull, opening into the nose. Usually they help us stay healthy.
The sinus cavities normally make mucus, which is helpful in removing bacteria and in removing pollutants.
So as you breathe in the air goes into the sinuses, the air hits the walls of the sinuses, particles in the air stick like a fly paper to that sticky mucus, so that the air that you then breathe into the lungs is much cleaner than it would have been otherwise.
But when you get a cold, sinuses can become infected. Most commonly, the sinuses above and below the eyes.
If the nose gets infected, it'll easily block off these narrow drainage canals from the sinuses into the nose, so then mucus fills up in the sinuses. And if the sinuses really fill up with mucus and are blocked, bacteria in the nose can then make their way into the sinuses, and then they start replicating in the sinuses, and then you have an infection.
When the sinuses are infected and all of these secretions do not come out, they can then get a significant number of symptoms, including pressure, pain in the face. If it's a significant infection involving bacteria, they may have fever, and usually a yellow discharge.
A sinus infection involving bacteria is called acute bacterial sinusitis. Heidi knows the symptoms all too well. She has problems with her sinuses frequently because she is often congested due to asthma and allergies.
My nose starts getting stuffy and or runny, and I start getting headaches on the top of my head usually. And then it usually travels into my chest and I start coughing.
Symptoms of sinusitis include nasal discharge containing green or yellow mucus that lasts for more than 7 days, upper tooth discomfort, no sense of smell or difficulty smelling, cough, headache, especially in the forehead or in the cheek areas, and fever.
Most of the time, it won't be overall pain and fullness in the head. It will be more specifically located to one of the sinuses, or here or up here, for example. And it will be fullness, pain, throbbing. They will have fever. Some of this infected material may make it out the sinus into the nose and down the back of the throat. They feel sometimes that they're draining infected, bad tasting phlegm.
Bronchitis is an infection of the breathing tubes that carry air from the throat to the lungs. They're called the bronchi.
And these bronchi are lined with cells which, when you get an infection, either viral or bacteria, become inflamed, they become irritated, and people have cough.
And then you have an episode where you start coughing and bringing up big chunks of mucus, and that may last a week, 2, 3. That's an acute episode.
Dr. Siegel's patient, Emmanuel, struggles with bronchitis frequently.
Put your tongue out.
He has a medical condition called COPD, chronic obstructive pulmonary disorder, so his condition must be watched closely.
For people who have underlying diseases of the lungs, those patients are much more likely to get a bacterial infection. You really would like them to contact their doctor early.
Pneumonia is an infection of the lungs by either viruses or bacteria.
So we're not talking about the bronchial tubes going down to the air sacs anymore. We're talking about all those air sacs that are down there. And both viruses and bacteria can get down there and they'll create infection in a section of the lung.
Pneumonia can be very serious, even life-threatening. The most common symptoms include a long-lasting cough that may be dry or wet, bringing up green or yellow mucus or sputum, shortness of breath, chest pain, and fever, often over 101 degrees.
The patients frequently have cough, they may or may not have sputum production, and they usually have fever. And many times they're extremely fatigued.
A healthcare professional may suspect pneumonia if the symptoms last longer than 5 to 7 days, are severe, or if they occur in a person at risk for pneumonia because of other medical conditions.
And when we see the patients, if we listen to their lungs and we hear abnormal sounds, we will confirm that by getting a chest x-ray.
5 years ago, Betty knew what she was feeling was not an ordinary cold. When she couldn't reach her doctor, she went right to the emergency room.
I felt very weak and feverish. I took my temperature and it was over 103, almost 104. My chest x-ray showed that I had pneumonia. They immediately gave me IV medication and in the emergency room and admitted me to the hospital.
Betty's symptoms were obvious and her pneumonia was serious. Her story is a reminder that we need to listen to what our bodies are telling us and take action.
If any patient has high fever that's persisting more than a day, or they're really feeling that they're very debilitated, or they're unable to eat and drink and keep fluids down, or they're becoming short of breath, those patients should contact their physician and at least talk to them on the phone, discuss their symptoms, and see whether they need to come in to see their doctor. The other group of patients that should contact their doctor early are patients who have underlying diseases that are significant. Heart disease, significant underlying lung disease, whether it's asthma or chronic bronchitis or emphysema or diabetes, or they're taking immunosuppressive drugs. Those patients should seek doctor attention early on in their illness.
C, E, and G?
Yeah. It's these three, and then you do this one.
There are so many reasons to want to get well as soon as possible. A family to care for, a business that depends on you, the simple desire to feel better. For Lauren Flanagan, being healthy means she won't disappoint audiences who have been waiting to hear her sing.
You can be booked up to 3 years in advance, and there's tremendous pressure on you not to cancel. And for years, I was the understudy of the people who canceled the most, and they never canceled. And then one night at the Metropolitan Opera, a colleague was ill, and actually she had an upper respiratory infection. And I stepped in, and it happened to be a television production with Luciano Pavarotti and Sam Raimi. And so really, literally, I was like an overnight sensation.
Lauren was ready for fame. She had been studying music and performing for many years. She's renowned in the opera world for taking on challenging new roles. That takes a lot of staying power.
Marathon runners train their legs and their body to carry them 26 miles. We train this to take us for 3 solid hours, which is kind of the equivalent of 26 miles for us.
Because of her career, Lauren might seek treatment right away, even for a cold. It's also important to contact the doctor when you start to feel symptoms, if you have other health problems, or have a high risk for respiratory infections. But anyone should seek medical care with a respiratory infection that lasts longer than 7 to 10 days, or gets worse.
If a patient is really sick with fever, producing thick green-gray mucus, and generally not feeling well, then there's a chance that this may be a bacterial infection.
Many types of antibiotics can help fight off a bacterial respiratory infection. But taking antibiotics when they are not needed can cause problems.
The problem of giving antibiotics where it's a viral infection, it's not a bacterial infection, is that there will be some bacteria around, and the more they see antibiotics, the more they're always making copies of themselves and replicating, the more they develop resistance to these antibiotics.
Resistance means the antibiotic can no longer kill the bacteria and cure the infection. Overuse, using antibiotics to treat conditions not caused by bacteria, is the most common cause of antibiotic resistance. That's one of the reasons for seeing a healthcare professional when you have a respiratory infection. She or he will determine what treatment is best suited for your particular infection and your medical history. Remember to bring a list of other medications you're taking, and patients should keep track of any recent prescriptions they've had, including antibiotics.
If they've recently taken an antibiotic, they need to inform their physician. Even if they took a few dosages of an antibiotic, it can lead to resistant bacteria, and we can't treat patients with the same antibiotic again. Secondly, if they have any allergies or they've had bad reactions to antibiotics, they should inform their physician so we can make an appropriate decision on what antibiotic should be used.
Antibiotics may be associated with serious side effects, so make sure to stay in touch with your doctor if you experience them.
Some of it may be nausea, some of it may be some GI, gastrointestinal distress. And so if those symptoms are relatively mild, the patient does not need to call their physician. But if the symptoms are becoming very significant, like bad dizziness or other symptoms or rash, they should contact their physician to see whether the antibiotic needs to be changed.
I encourage patients to call me if they have any question or if anything is happening that seems out of the ordinary to them. But I also encourage them not to stop the drug without calling me and letting us discuss what's going on first.
As Lauren knows, it's very important to take all of the antibiotics you are prescribed.
I'm a good girl. Yeah. If it's 10 days, it's 10 days. If it's 5 days, it's 5 days.
It's very important that when an antibiotic is prescribed that the patient take the full course of antibiotics, because if they take a few days of antibiotics, they start feeling better, and they stop the antibiotics, the problem is the bacteria that tend to stay in their body are resistant bacteria that can continue to grow, and then they may end up getting a more severe infection with the resistant bacteria. So we're going to have you take an antibiotic.
Dr. Siegel also tells his patients not to worry if symptoms outlast the medication.
When we use an antibiotic to treat an infection, what we're trying to do now is use shorter courses of antibiotics, and many times they're more potent antibiotics. And so a patient may take 5 days of an antibiotic, but their symptoms may continue for another few days even though they've completed an antibiotic course. And as long as they're feeling relatively better, their fever is gone, they need to just let their body recover from the infection.
So, if you have been prescribed an antibiotic, let's review the rules. Take them exactly as prescribed. If you're experiencing side effects, talk to your doctor. Emmanuel says being careful with his medications is one of the reasons he's still able to keep moving, even after 40 years of coping with a chronic illness.
I follow the prescription that the doctors gave me. I don't deviate. and I don't miss SETI. And the fact that I'm here talking to you, I think is the result of following the instructions of the doctors.
And remember, never share antibiotics with others. Sharing might result in not completely treating your own infection, giving the wrong antibiotic to someone else, and contributing to antibiotic resistance.
It's very important that if patients have a few antibiotics at home, that they don't share those antibiotics and that they don't take a few antibiotics just to see if they're feeling better with them.
Often a respiratory infection lasts for a few days, and even if it does not become bacterial, you don't feel good.
When patients have viral infections, it's very important that we let them know that it is a real infection. They may not need an antibacterial or an antibiotic. However, they are having real symptoms.
Because most of the fever and aches and feeling lousy, when you have an infection like that, those symptoms are due to our own immune system kicking out chemicals fighting the infection.
So generally what we say for viruses, what we really want you to do is we want you to help your body fight the infection. We want you to rest, we want you to take it easy, drink fluids, make sure that you're taking in enough liquid that you don't become dehydrated. We want to make sure that you continue to take your other medications that you need for your other medical illnesses, and generally wait out to be sure that you get better on your own.
And while you're waiting, there are some things you can do to be more comfortable. Be gentle about how you blow your nose. If the air is dry, add humidity to a room or your home with a humidifier.
Steam's always good. Sometimes I just go through a routine. Steam up the bathroom, sit in there.
If you're experiencing discomfort in your face, apply warm towels or facial packs. If you smoke, stop. Stay away from other smokers. Smoking and cigarette smoke can make your symptoms worse. And wash your hands frequently, especially if you are in contact with others.
Mom, why is there a cat on the truck?
Heidi's children often bring home colds from school. When she gets sick too, she tries to make time to take care of herself.
When I feel like I'm coming down with something, rest is very important. Luckily, I have a babysitter and family around to help me with the kids, and I usually try to stay in bed as much as I can.
As we've said, there is no cure for a viral infection, but there are medicines that can ease the symptoms. Some you can buy without a prescription, but read the instructions carefully. For example, over-the-counter nasal sprays should only be used for a short time.
The kinds of sprays that shouldn't be used for more than 3 days are the decongestant nasal sprays. But they can be effective, and we often, in performers, they have to perform tonight, we may use it just to get them through the performance on a particular 1 or 2 time basis.
So if you're very stuffy in your nose and then you spray these nose sprays, they shrink everything in the nose down. Wonderful, great, it's more open and patients can breathe again. However, when they wear off, the swelling in the nose recurs and often gets even greater than it was to start with. We call this a rebound congestion.
Instead of sprays, you might use over-the-counter antihistamines or decongestants, or a combination of both. If you are also taking medicines for another problem, check with your doctor or pharmacist before taking cold remedies. Pain relievers, such as ibuprofen or acetaminophen, may be helpful for aches and pains. Again, read and follow all medication label instructions. And keep track of whether you're feeling better or worse.
If you've got a viral infection, over time we expect that you should be slowly improving over days. If there's a change in that and the patient, instead of improving, suddenly takes the turn and becomes worse, they develop more fever, they just feel more incapacitated generally, they have particular pain anywhere, the mucus changes from maybe just gray-green in the morning to every time they're coughing. That certainly is a disturbing sign to us, and they should alert their physician definitely that they've had these change in symptoms.
Those kinds of changes typically indicate that a secondary infection has become involved. So I think that any significant change in your symptoms that appear to be a worsening should alert the patient that this infection, whatever it is is taking a negative turn, and that should always be a red flag to seek medical attention.
Lauren Flanagan grew up with asthma and frequent bouts of bronchitis. But with careful attention to her respiratory health, she is able to enjoy her garden and the cat that she discovered there one day.
My neighbor said, "Girl, that cat's a diva." And the cat went, "Yes." And so she said, "Oh my God, that's your cat." I said, "No, it's not my cat." She said, "Yes, that's your cat."
Lauren also enjoys a career that wins her acclaim around the world. And if you're not an opera fan now, maybe she can convince you to try it.
And it's not like, you know, the opera ain't over till the fat lady sings. It's just not like that anymore. And so you just have to try it.
A respiratory infection is uncomfortable, and it can be dangerous. We hope this program has helped you learn about what to do and when to get in touch with a healthcare professional. Remember, antibiotics are a true medical breakthrough, but they are not the answer for every respiratory infection. In fact, taking an antibiotic for a viral infection not only won't cure it, it could lead to antibiotic resistance. So the antibiotic won't work as well when you really do need it. If your symptoms last more than a week or 10 days, are severe, or seem to be worsening, you may have a bacterial infection. A bacterial infection is not something you can tough out. It's serious, and you need treatment. Your doctor might prescribe an antibiotic to help fight the infection. If so, you should take the medicine exactly as prescribed. Remember, your healthcare professional is ready to answer questions about your symptoms, possible treatments, and side effects. Don't be shy about asking for expert help. And breathe easy.